Good afternoon, everybody. First, I want to thank the organizers for inviting us to share some reflections and thoughts about community health. Despite the fact that my name has a Spanish origin, I'm not able, unfortunately, to express myself in front of you in Spanish, so I will do it in English. So, it will be much more convenient. So who are we? Very briefly, Médicos do Mundo, excuse me, is an international network of medical NGOs. We have 15 chapters all around the world, and in 2015 we worked in more than 80 countries for a budget approximately $135 million. So here is a map to see quickly where we work. In France, we provide medical and psychosocial care to the most vulnerable populations, and we advocate also to end health inequities around three core principles. The first one is to provide health care and make it available and accessible. The second one is to bear witness and to advocate for a better access to healthcare and to rights for health. And the third one is to support communities seeking social change. So we are not ourselves a community-based organization. We are a medical organization, but we actually aim to support communities in their will to change societies and legal environment. So we have 5 priority areas, and I will focus on what we called harm reduction, which is, that's how we define it, a medical and political approach based on public health and human rights. This is how we name our work with drug users, sex workers, and people from sexual and gender minorities. Around very basic principles. The first one is to be pragmatic. The second one is to base our actions on a non-judgmental approach to others, to respect and accept the different practices and lifestyle, and of course to have a low or an unconditional threshold for accessing our programs and activity. Harm reduction is a holistic approach. Here you can see what we called our magic square. So it's between HIV, hepatitis, sex, drugs, and of course there is this line with laws and social norms, which in many cases are obstacles to accessing healthcare. So this is in the same time a public health response, in the sense that it has been recognized as the most effective method for reducing HIV and HCV transmission among the highly exposed groups. So we base basically our work on scientific evidence, and in the same time this is also a community response for social change, because we aim to help empowerment and active participation of the groups we work with, notably through the creation of self-support groups as a way of strengthening civil society and recognizing expertise of these populations. So we are a service provider, but we also aim to be more than that, specifically through involvement and empowerment of beneficiaries, and also through modeling and dissemination of our work. And then we aim to contribute to a global advocacy strategy in order to enhance and improve access to healthcare and access to human rights. Because of course the general umbrella of our work is the right to health that Diego referred to previously, which belongs to social, economic and cultural rights of every individual. As you know, health is a multi-dimensional thing, so there is in the same time individual factors, social, community factors, but also general socio-economic, cultural and environmental conditions, which actually have a strong influence in our health status. And so we aim to tackle the inequities that to which these groups of populations, marginalized one, face in the daily life to access healthcare services or human rights in France, of course, in many countries where they face this difficulty. With regard to the community mobilization, of course, the community mobilization is one of the roots of our engagement from the Denver Principles in 1983 to a more recent declaration. I just chose the Atlanta Principle in 2014 because I found it interesting to note that it's a new set of demands calling for, focusing on access to new prevention tools like PrEP and PEP. PEP is not new, but you know, wider access to. And today, so this mobilization and commitment is a core principle of every policy against HIV and AIDS in the perspective that that has been explained previously in this today of ending AIDS. So key populations have to be targeted in a public health approach. But in the same time, of course, there is a human rights issue in many places, and of course, for many of these socially disadvantaged groups, access to healthcare is facilitated by legal and social change, as I will talk about after that. So, of course, I just put some figures about 35 years of community mobilization. Of course, this is just a very partial overview. And in the same time, during the development of community mobilization from the early 80s, there was also the development of the health promotion. And within the Ottawa Charter, the first step in 1986, and in this declaration, I don't know if you can actually read the poster, I hope to. But community engagement is also one of the core principles of health promotion, and so this is also a framework, a political framework where we act in a health promotion approach. So changing the legal environment, mobilizing community, and many other steps, strengthening individual and collective skills, for example. So why make people getting aboard? Why promote community involvement? Of course, because the people that are in stake know better than public health officials most of the time what is good or what is adapted and what for them. So most of the time it's to make policies and programs more relevant and more adapted to the people's needs and more responsive to these needs that are changing, but also to avoid or reduce negative impacts, because public health policies and programs, as you know, when they are implemented without the participation of people, can have actually strong negative impacts on the people that they are supposed to help. But in reality, this is not the case. To make policies and programs more effective, but also to build relationships based on respect and mutual understanding, and then finally to strengthen individual skills and community engagement. So what we've learned a lot, of course. I just put some ideas here. That first, the most effective communities have been in the forefront of the response, and most of the time it has been successful. So we have to keep that in mind for the futures. That institutions have been shaken by the HIV epidemic, so we actually contributed to make society change, and of course in our benefit. That alliances and coalitions have been powerful fighting tools, specifically between communities, researchers, public health officials, and many other stakeholders. When we were discussing about access to PrEP previously, I was also thinking about that because with researchers, I'm not talking about the pharmaceutical industry, but clinical researcher or preventive one, there are strong coalitions and alliances that can be built. It's clearly the way we actually obtain PrEP in France. This is also because researchers got on board with us in order to influence the government and the Ministry of Health. In some parts of the world, we saw improvements in health, access to new drugs, prevention package, development of sexual health services, etc., but also in civil rights and recognition of the needs of sexual and gender minorities. Nothing of that has been achieved without mobilization and fight. And as I told you previously, it has been successful, and in many places, it still is, even if difficult. So some of our current challenges, as Vanessa just told us, there are still 20 million of people living with HIV and AIDS without treatment in the world, and many, many, many more of people that don't have access to prevention tools, and specifically new prevention tools. There are still many countries that criminalize HIV, being HIV positive, homosexuality, sex work, drug use, abortion or family planning. There are still many countries that pathologize transgender identities. There are still many countries that don't provide healthcare to those marginalized people, whereas they are in the same time considered, as I told you before, as key population for HIV/AIDS. And of course, there are some groups that are highly exposed, and more than the general one. We talked about that this morning. Jürgen Rockström referred to that, for example, MSMs and transgender people of color. And recently, we also have seen an emerging voice of HIV negative people in relation with new prevention tools. This has been quite new in the history of HIV, of the fights against HIV, that negative people, independently from historical people living with HIV voice, raised their voice in order to ask for these new prevention tools. So what to advocate for and against? For setting public policies that promote access to care and rights, for legal protection and effective access to justice, for funding and implementing programs that focused on the needs identified by the people directly affected, implemented with a community approach, recognizing the expertise developed by the people, and merging healthcare and human rights in the same time. For community involvement in the development, implementation, and evaluation of policies, for inclusion and against stigma, discrimination, and violence, and of course for the decriminalization, of homosexuality, transgender identities, sex work, and drug use. So some final messages. Many successes have been achieved through our mobilization. Visibility, I know that this is not exactly an issue globally in our countries, but this is a key issue in many others. For successful social change, we have to tackle the health inequities buried by the LGBT plus people, because there are specific needs that we have to take into account, and in that direction, proportionate universalism can be a promising approach. We have to promote medical and social interventions through partnerships between communities, researchers, and public health officials. I already said that. Involve the people at all levels of decision-making and service delivery. Sustain the fight against stigma and discrimination, and change legal norms where they criminalize all the key population for HIV/AIDS and viral hepatitis. Thanks a lot.